You've probably heard of flu shots and COVID-19 vaccines, but have you ever thought about getting a vaccine for RSV, respiratory syncytial virus? If not, you're not alone. Many people don't realize how serious RSV can be, especially for newborns, pregnant women, and older adults. RSV is a highly contagious respiratory virus that affects people of all ages. For most, it feels like a bad cold, but for infants, the elderly, and people with weakened immune systems, RSV can cause serious complications like pneumonia or bronchiolitis. That's where Abrysvo comes in. Developed by Pfizer, this vaccine is designed to protect both newborns through maternal vaccination and older adults from RSV-related illness. In 2023, the FDA approved Abrysvo, making it one of the first vaccines available to combat RSV effectively. So, what makes this vaccine special? Let's break it down with 10 key facts you need to know. Number 1. What is Abrysvo? Abrysvo is an RSV vaccine that helps prevent severe respiratory infections caused by the respiratory syncytial virus. The vaccine is unique because it's designed for two key groups: pregnant women so they can pass immunity to their babies before birth, and adults age 60 and older to reduce the risk of severe RSV illness. Since RSV can lead to hospitalizations, breathing difficulties, and even death in high-risk individuals, having a vaccine like Abrysvo is a major breakthrough in public health. Number 2. How does Abrysvo work? The Abrysvo vaccine contains a piece of the RSV virus protein, which helps the immune system recognize and fight RSV if a person is later exposed to the virus. For pregnant women, the vaccine is given between 32 to 36 weeks of pregnancy, allowing their bodies to create protective antibodies. These antibodies are then passed to the baby, helping shield them from severe RSV infections during the first 6 months of life. For older adults, Abrysvo triggers the immune system to produce antibodies, reducing the risk of RSV-related hospitalizations. Simply put, Abrysvo works by training the body to fight RSV before it can cause serious harm. Number 3. Who can get the Abrysvo vaccine? Right now, the FDA has approved Abrysvo for two groups: pregnant women in their third trimester, 32 to 36 weeks of pregnancy, and adults aged 60 and older. If you're a healthy adult under 60, you don't need the vaccine right now. However, research is ongoing to determine if RSV vaccines could benefit more people in the future. Number 4. How effective is Abrysvo? Clinical trials have shown that Abrysvo is highly effective in reducing severe RSV cases. Studies found that the vaccine is 82% effective at preventing severe RSV-related illness in newborns when given to pregnant women. For older adults, Abrysvo is 67% effective in preventing RSV infections that lead to serious complications. These numbers prove that Abrysvo is a powerful tool for preventing hospitalizations and severe RSV complications. 5. What are the side effects of Abrysvo? Like any vaccine, Abrysvo can cause mild side effects. Most people experience only minor discomfort, but the most common reactions include pain, redness, or swelling at the injection site, mild fever or chills, fatigue, muscle aches, and headaches. For pregnant women, there were some concerns about a slightly higher rate of preterm birth in clinical trials, but the overall data still supports its safety. If you're pregnant or over 60, it's best to talk to your doctor to see if the benefits outweigh any potential risks for you. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. How does Abrysvo compare to other RSV vaccines? Abrysvo is not the only RSV vaccine available. Another option, called Efficacy, was developed by GlaxoSmithKline, GSK. There are a few key differences between these two vaccines. Abrysvo is approved for both pregnant women and older adults, while Efficacy is only for older adults. Both vaccines are given as a single shot and offer strong protection against severe RSV illness. However, the biggest advantage of Abrysvo is its ability to protect newborns through maternal vaccination, something Efficacy does not offer. Number 7. Where can you get Abrysvo? If you or a loved one is eligible for Abrysvo, you can get it at hospitals, OBGYN clinics for pregnant women, pharmacies like Walgreens, CVS or Rite Aid, and doctors' offices. Most insurance plans cover the vaccine. but it's always best to check with your provider to confirm costs. Since RSV season typically peaks in the fall and winter, many healthcare providers recommend getting vaccinated before the season begins. Number 8. Why is RSV prevention so important? RSV is one of the leading causes of hospitalization for infants and older adults. Each year, more than 58,000 infants in the United States are hospitalized due to RSV. Among seniors worldwide, RSV causes over 160,000 deaths annually. Severe RSV can lead to pneumonia, breathing problems, and even death, making prevention a priority. By getting vaccinated, you can reduce the risk of severe illness and help protect those who are most vulnerable. Number 9. What's next for RSV vaccines? Vaccines are always evolving, and researchers are working on expanding RSV vaccination recommendations for younger adults and people with chronic conditions. Some scientists are also developing combination vaccines that could protect against RSV, flu, and COVID-19 in a single shot, making it easier for people to stay protected against multiple respiratory illnesses. Additionally, researchers are looking into ways to develop longer-lasting RSV vaccines that could provide protection for multiple seasons instead of requiring yearly vaccination. With ongoing studies, there could be even better RSV vaccines in the near future. Number 10. Should you get the Abrysvo vaccine? If you're pregnant between 32 to 36 weeks or over 60, you should strongly consider getting Abrysvo. The vaccine protects newborns from life-threatening RSV infections, reduces hospital visits for older adults, and has been proven safe and effective in clinical trials. However, every individual's health situation is different. It's important to consult with your doctor to determine if this vaccine is right for you. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.